What's up, guys? Today I want to talk about MARPE and why you need to skip MARPE and just do double jaw surgery. And this is such an important video to make because nobody talks about the dark side of MARPE, of when it goes wrong and what to do to fix it, right? Nobody talks about this because if jaw hacks talk about this, it would ruin his business model. People would realize it's too high risk. I'm not even going to get a consultation. I'm going to just do double jaw surgery. I'm going to just move on with my life. And the doctors that interview jaw hacks or vice versa, the ones that do MARPE, they never talk about this. They never talk about this. And then when people that do MARPE interview with jaw hacks, they then are concerned and they do interviews about asymmetry. If everybody knew what I knew and that I went through during this process, nobody would do MARPE because when shit goes wrong, it goes wrong bad and really fast. It's not like you do a speeding ticket. I'm going to put it in a good example. It's not like you speed 5 or 10 miles over the limit. Okay, you get a ticket. You can recover from that. You pay it, move on with your life. But let's say you get caught drinking alcohol while you're driving. Now you have a felony. Now you go to jail. And now you have to waste so much money. That little mistake just went bad fast. That's what MARPE is. MARPE is getting a DUI. Double jaw surgery is like a speeding ticket. And that's crazy to see. MARPE, to me, now that I think about it, is more high risk than a double jaw surgery. That's the mistake that people are advertised about MARPE. That it's less invasive, more safe than double jaw surgery. No, it's not. It's cap. Because botched double jaw surgeries can get fixed. And it's only limited to this part of your face. And there's thousands of case studies of double jaw surgery. So it's been perfected over time. Because so many people have had this deformity here that there was a need to develop technology to fix it and do it right. That's why double jaw surgery is a safe procedure and most people get great results. And even if you get botched, just do it again. The only thing that's limiting you is money. Take out a loan if it's really bothering you. But you know if you get it right, you will be done and move on with your life. And even the complications of a jaw surgery, now the worst ones is you lose control of your muscles here, but it's very rare, or numbness. I have numbness on this teeth from TADS a little bit, and it's no big deal. I had numbness in my upper palate from MARPE, no big deal. People overrate the numbness. It's not affecting your vision. It's not affecting your self-esteem. It's just a loss of sensation that nobody can see or even recognize because it's visual. They are visual. The numbness is sensation. So it's not a big deal what you get from double jaw surgery. But the complications from MARPE are so crazy and some are irreversible that I have to talk about it. I need to save people's lives from making this grave mistake. So let's look at this first case study. This woman, an OG from Reddit, went through the exact same thing I went through. And I just want to say to this woman, if you ever watch this video, very beautiful woman. I understand what you went through. And to be honest, the before and after, I still feel like similar level of attraction. Because the overall package is still bomb. It's still good. You look fantastic. And since then, this woman, she just wanted to do a MARPE from the start. She ended up doing double jaw surgery to correct this. Right? And same with me. I started down this journey just to do MARPE, just to do airway. When I started this in 2023 to 24, when I graduated college, I was like, okay, I got my degree, I'm fit, but I'm missing something. Something with my health is wrong. And I realized my intermolar width, the sleep apnea study, the tongue tie, the myofunctional therapy. I literally started from the least invasive procedures, and now I'm here, where I'm about to do the most invasive double jaw surgery this year. I started this not wanting to get surgery for cosmetics, and now I am. Cosmetics and function. Ignorance is bliss, guys. I thought things were bad back then when I was like, are my looks good enough? Is my health good enough? And now, knowing what I know, I was like, I would tell myself, you're blessed. Don't even do this process. Just like, if you are, just go straight to double jaw surgery or do other methods. Because I really should have attempted to really diet it down and see if the body fat was my limiting factor back then. But I know it was not. Because I looked at my CBT scan now and it's a structural issue. But I would have just told me myself in the past, like, just go live your life. Just like the second surgeon I consulted with, she said, I'm a good looking guy, you're handsome, I wouldn't do jaw surgery on you, because she's basically said if somebody cares about you, then they're not going to do this surgery on you. Because I don't look like recessed, like I don't look severely recessed, I'm like in the middle, but I have the symptoms. And she said, just go move on and live your life, have a good life. And honestly, I would have just told my old self that, because this happened to me. And it happens to many people. This complication happens to way more people than that. It's not a 10%. It's more like a 70 to 80%. I think this happens to people. At least 50. Because, and you don't believe me? Well, I found people from 3 years ago, this woman, myself from 2 years ago, and then this guy around the same time period on Reddit that I found who went through the exact same thing, same asymmetry, same complication from the device. So the device placement or the device itself is faulty in itself. And mine was a custom MARPE. These people had custom MARPEs, I believe. But the same thing happened. And this is the worst part about this, guys. The asymmetry from MARPE, at first, the one that concerned me was the mouth. But now I don't really care about it. I don't really care about being asymmetrical here, because I know it's going to get fixed. There is a solution for it, which is double jaw surgery, using elastics to get the teeth right as much as possible, etc., etc. There's many ways to fix the mouth. Right? There's been more severe cases than mine that have gone fixed. So I know it's like, all right, I just got to be patient, follow the process, and then do it. Enjoy my life in the meantime. That's so important. The things that MARPE can do to your face if it goes wrong, it doesn't just affect your mouth area. It's going to affect your eyes. Your eyes are the ones that Jaw Hacks does not talk about this. And some of the interviews I've seen with like Dr. Alfie or other surgeons is that they say that one whole side of the face drops down when people do MARPE. Like, they've seen it. And what I didn't understand is that they're not just talking about the cheekbone and the maxilla. They're talking about the fucking eye region and everything included. Look at the eye symmetry between here. Like, look at the tear ducts. One's a little higher than the other. I think on this one, so she already had this before, so it's not a big deal, but her eyes look way more symmetrical because her bones were like, there was harmony. One muscle is not being pulled down more than the other, so it makes her asymmetry look weird here in the eyes to me. Now, I don't think she had a skeletal asymmetry in her eyes from the MARPE. I think it was just limited to the cheekbone area and the maxilla. But I would be surprised if it didn't affect her eye region. But she's had double jaw surgery since, and she looked great. She looks like the before, but better. So I don't think her eyes were affected. And I think it's a lot of has to do with the muscle tissue being pulled down and, making your eyes look way less symmetrical. But I think in my case and in the other guy's case, I think our orbital floors changed. That's the thing that MARPE is going to change, guys. Because some people get a fracture here next to the nose and not here on the other side when they do MARPE. And I think that's what causes the drop on one side of the face. Because if you get the fracture here and not here, well, this is going to be like the supporting base to push the other side even more. And I think that's what happened to me. I remember when I was doing expansion, and during the expansion phase, I remember I went to the gym and I did a light jog, guys. And this was a mistake. If you are doing MARPE and you're in the process of expanding, stop working out, stop doing sprints, stop doing any form of exercise, just chill and relax. Because when I was like moving, and this shouldn't happen. Doctors should say you should change your lifestyle if you're going to do this, but they never mentioned it. I've never mentioned a doctor, not my ortho, so I'm not going to just put the blame on him. Any doctor in general say you need to chill on the exercise. Don't do any high intensity when you're expanding because your bone is already broken. It's susceptible to damage, more damage. So if you do a sprint while your bones are loose, guess what? The impact from up and down from the sprints plus the pressure going this, you can cause another fracture that was not intended in your face. And I remember after I did the light jog to the gym that one day, I heard like a crack. I heard like somewhere around here. And I was like, well, that's kind of weird. And then it went away. And then soon after, I noticed the asymmetry form. And honestly, I'm not sure. It could have been my skeletal, could have been the placement of the MARPE, could it have been caused by my activity, my lifestyle when I did this? Because I was working. I got the MARPE placed when I was in my working season, landscaping. So I'm moving my body around and carrying up some stuff that are heavy every now and then, getting off and sitting on the mower. So a lot of moving up and down. That could have played a factor, right? So now let me go over my pre-MARPE scans. So as you can see, like here, it's not symmetrical. Like I think the bone here is already lower. Wait, I think it's already lower than this other one. But because I was so narrow, I still had the harmony to me. And what happened is the MARPE gets screwed into this part of your mouth. But as you can see, look, this one is slightly higher than this one. So if the MARPE is designed to stick to your palate, which is what they do. MARPE is not designed for the teeth occlusion. It's designed to be placed and like be snugged up into this. And most of the times, it's designed and it's snugged in a slight cant. I noticed that and I was like, that looks kind of concerning, but you know what? Maybe my bones are just going to hold their position. And while the pressure is not even, I still have the zygo supporting me. So even though one's getting pushed slightly down, the other one's slightly up, it's going to even itself out because I have other bones to stabilize the face right here. Right? It's not going to drop forward. It's not going to drop because I got bones here supporting. I got this whole bone. But that's not how it works. Right? This side right here, right now, it's currently a little bit outside this bottom one. So this tooth right here is getting uprighted. So it's getting turned upwards. And this one is getting turned slightly inwards. And then the jaw surgery is going to do the refining touches to like make sure everything's good. But that's the thing, guys. You shouldn't go through this process. You should just expand the desired amount. But even if you expand the desired amount, if you develop a cant, you have to do so much BS to just get the bite right. Before I even decided to do a double jaw surgery, I decided to do TADs to bring my teeth up. And it kind of worked, but it didn't bring all the teeth up. I realized this was a skeletal issue, so I wasted money on TADs. For a lot of you, it's a lot of money. For me, I don't even care anymore because it was an effort to better myself. But it's something I should not have gone through. If I would have known this from the start, I would have just been like, you know what, I just need jaw surgery. I wouldn't have to go through this process. And now, guys, this is the problem. MARPE did what it was supposed to do. It fixed my nasal breathing. I suffered for 23 years. I don't want to sound like a victim, but for 23 years, I could not breathe through my nose. I couldn't go to bed. I took hours to fall asleep. I had to use Vicks, the Vaporoo that uses weird garbage so you can, breathe through your nose. I knew it never worked. I had to use saline. I had to use all this garbage. And now I don't have to worry about that anymore. Breathe through my nose like a king. But it came at the expense of my harmony, my bite, my occlusion, my aesthetics in a way. I like that I'm wider, but if I was wider symmetrically from the bottom up, I would have rated this experience 10 out of 10, and most people get that result. But if yours is slightly off just a little bit, with every millimeter, it gets worse and worse exponentially. It's not like, no. This is worse. And look, this is the one asymmetry, and I'm going to show you examples that you can develop. I got a little bit of this. The guy on Reddit developed this as well. This girl looks like she got it, but not really. I think hers was just limited to the maxilla. Which is, and I also want to say, a botched MARPE is going to lead to double jaw surgery. So if you're contemplating doing double jaw surgery with the MARPE, just do double jaw surgery. Just do it. Because then your botched MARPE, it could get fixed, but now you have to go through a whole process fixing it and still doing jaw surgery. Right? I never wanted to do jaw surgery, like I said. I just wanted to do the least invasive procedure, MARPE. But in reality, honestly, jaw surgery seems safer to me compared to MARPE because, like I said, if jaw surgery goes wrong, you could do it again and again and again and again until you get the right result. MARPE, you can't do it again and again and again. Once you do it, you're stuck with the results. And wherever your bones settle, that's where they're going to settle unless you intervene skeletally with the surgery, double jaw surgery. And not even a double jaw surgery can't fix all the asymmetries. Dr. Alfie has mentioned this. You can't fix the asymmetries from the midface up. You can only fix it from the nose, the LaFour cut down. And yes, it will improve your overall harmony. But there's some things you just can't get back once you screw yourself with the MARPE. And I'm going to show you what I'm talking about. MARPE could give you vertical dystopia. Vertical orbital dystopia? The VOD. Yeah. So MARPE, like this guy was likely born like this. But for a lot of us who start MARPE, we don't start like this. So what MARPE does, it like lowers your orbital floor. That's what I think happened to me. And it lowered it slightly. Where I noticed it in pictures and I'm like, what the fuck? Now I kind of have like an asymmetry in my skin on the eyes, and like it's just not the same. Like it doesn't bother me because I don't think about it, but whenever people ask me about MARPE and would you do it, I honestly say don't do it. Because even though you will get the nasal breathing, I'm not sure if you're ready for the mental warfare that's going to go through your mind, seeing yourself change for the worse in some aspects, right? This is what happened to the guy on Reddit. This is what kind of happened to me, and that's what happened to this girl. Slightly. Very slightly. I don't think she actually experienced it. Maybe the muscle was just different. But for many people who do this, the asymmetries from the orbital box are just so hard to repair because it's so high risk. Like a MARPE, which people don't talk about. MARPE is more high risk than double jaw surgery. You need to learn that right now. You need to learn that. And, like, I'm not going to say that I'm completely botched because, look, MARPE fixed something that I dealt with for years. So it's easy to say in hindsight that I would not do this. But I remember at the time, my life was hell. I wasn't enjoying anything about my life. I was, like, just trying to breathe. I was just trying to function. Always feeling tired as hell, like, never my 100%. Always sounded congested, right? When you have a small nasal cavity, which could be improved with the double jaw surgery, but not in the same way that a MARPE can. Your voice is going to sound extremely congested, and you will not be able to articulate your thoughts well. I would have to repeat myself so much, since I had a very small upper palate. Harmony, I had harmony, but it was narrow. I would bite my cheeks a lot. I had trouble speaking in general. I would have to really put some effort into just normal things that most people don't have to go through. Like, there's some people that are well developed, they sound very good. Not only can you understand them really good, but they articulate easy. Like, they don't have to stress their muscles, so they don't have to repeat themselves too much. They don't stutter, they don't catch their tongue. They can just speak and breathe like they're supposed to, right? But back to the MARPE. This is the asymmetry that you can develop from a MARPE. And it's the eye asymmetry. Do you really want to do surgeries to fix the eye? This guy has to do some invasive procedures. So do you want a Frank Tufano max because your MARPE got botched? Or because your MARPE made a slight asymmetry to your face? Even though it's millimeters different. And you know what? It's not a big deal when you meet somebody and they have an overall harmony. Like, it's not the worst. But it's the worst when you were not like this before. You were born right for the most part in that area, and then it got worse when you did this procedure, right? Let me go back to this. Well, like I said, my MARPE, like, it was snugged up to this part here, and I'm not surprised. That's why it was slightly canted, because it's designed to fit your upper palate right here, your vault, right? And because this part of the vault was slightly higher, the design was going to make me a cant. It was just going to happen. And I just didn't think about that in advance. That's what you don't know. And most orthos don't know or care. They think they can fix everything because whatever. They've fixed so many cases before. They're like, just fix it. But they don't ever think about the worst possible scenario because maybe they just don't have the experience or they don't want to bring it up because they could lose a sale. Now, I'm not going to, like I said, I'm not going to really dog my ortho like that because he's been very communicative with me. Every question I've asked, he's answered. He's made time to talk on the phone with me, FaceTime. When I wanted to do TADs, he's like, all right, I recommend you to the endodontist here. Like, I work with him. We'll collaborate. Like, it's been a smooth process whenever I made a request. Like, I want this, I want that. He's done it for me. So it's not like he's been vague or trying to avoid it. Like, when I told him about the cant, it's like, I want to fix the cant because I got the cant. Like, he wanted to do elastics, but I'm like, you know what? Do you see what I'm seeing? Like, I don't want it to be so gummy and so drop down. Let's do TADs. This was before I wanted to do double jaw surgery, before I even thought about really doing it. The TADs didn't work, and that's when I was like, you know what? I'm going to have to do double jaw surgery. So now we've adjusted the plan for double jaw surgery. And I appreciate he's been working with me and understanding my needs. But even then, some people just have to be the pioneer of a botch to save somebody. And in this case, I'm the pioneer. So like I said, I'm not going to blame the doctors because doctors don't know everything. They don't understand the perspective of a patient because most of the time they've never been one. And I'm not going to sit around saying like, oh, you should sue, whatever. It's just, that is worse. That's a waste of time. Unless I was severely botched, like my whole fucking face fell to the floor or something, I'm not going to go out of my way to get back. There are solutions to these problems. It just happens to be with more surgeries, which is a pain in the ass to do. So this is what I kind of developed, just slightly, just like this guy. This, like from a distance, you don't really care, but like when you were perfect before, and then you get this from a procedure that's supposed to make you better, it's like, what the fuck, right? It's crazy. Vertical dystopia, and like this guy, this is a great example. Vertical dystopia, right? So like you see how the pupil here is higher than the other one, and people say this is not really a deal breaker, but I think when you're old, nobody gives a shit, to be honest. But like when you're young and you have everything going for you, they say the eye area is like more important than the jaw, and I didn't believe that at first, but now I'm starting to think second. Otherwise, because honestly, some of the most attractive people ever, I mean, they got everything, but I think you can get away with having a weak to normal jaw if your eye area is good. I don't think it could be the same inversely. Like you could have a really good jaw, but if your eye area is kind of off, it's like people just don't lock in and get captured by your eyes, you know, because eyes really do make a difference, and that's what like bugs me a lot. Now, I don't think about this every day. I'm only making this video because Frank Tufano made a short about me on MARPE, like ruining your looks, and you know what? He's not completely wrong because if MARPE goes bad, it will ruin part of your looks, right? And I did agree with him at the end, like, you should just do a double jaw surgery in orthodontics. Because for most people, if you have a good bite, like let's say you already did braces before a MARPE and your teeth are straight, you have good harmony, and you have problems breathing, I would say just do a double jaw surgery because the time invested is so much less. There's people that started the double jaw surgery a year later than me, and they've done double jaw surgery before me. Because in the meantime, I'm trying to fix this mess up of a bite that I got from MARPE. Because my MARPE didn't go as I thought. It didn't go like this. It went kind of like this. And fixing this is so much more complicated for an ortho, for everybody. Because it's a skeletal change. There's only so much you can do. And this is what I think kind of happened to a lot of people. Like that girl is not the first person I've seen that's experienced MARPE like that. The guy and I think we're like same case in a way. But there's other people that go through this, but they don't speak up because why would you? Why would you show the world like, yeah, I paid thousands of dollars and it kind of went wrong and now I'm like this. You look like a fool, right? But I understand why people won't share their botch stories because nobody wants to. But it's important to share the dark side of the MARPE. It's important to share. This is what MARPE could do to you. Like, I think this is what happened to me and the guy and the girl and the other people who I've seen do MARPEs, and they just look asymmetrical. The MARPE splits this bone here. Like, it causes a fracture, and then the whole floor just sinks. You see how the orbital floor on this is way lower than this? That's what MARPE does to you, but it doesn't do it to you to this extent, I think. We're not perfectly symmetrical for the most part in terms of like the face, but most people are symmetrical in the eyes. Like, if for most people, their deformities are rarely in the upper third of the face, because I think the brain and the body prioritizes that development way more than the jaw. The jaw is not as important as like your eyes and your brain, so it starts like top down. So most people are good here, but not good here. But imagine you mess up here. It's like, what the fuck? You're going backwards. So what I think MARPE does when it expands wrong, like it did for me with the other guy and the girl, like I said, fracture here. It didn't cause a fracture here, and then because this was stable on this side and loose here from this fracture, then it's like even more force goes this way, and it has to go somewhere, so it goes down and forward, right? And now your whole orbital floor is sitting lower than the one on the other side. Now you have an asymmetry where you have to do cosmetic surgeries to get back to where you were. And that's the thing, guys. It's not only the asymmetry that you form, it's what do you do to fix it? And what you have to do to fix it is a whole other road, a whole other journey. And we already saw what happened to Frank Tufano with his eye surgeries. We already know the dark side of the eye surgeries. And knowing that, would you really want to risk it to get back to just normal, to where you were? High risk, potentially low reward or medium reward. It's not like jaw surgery where it's like medium risk, honestly low risk, in comparison, and you get a high reward. Are you starting to understand this? Vertical dystopia. Let me show you another example. Oh my god, what the? Oh, that's it. That was it. Let me show you this other example of a guy here. So, now this guy, he was born like this. He didn't do a MARPE. But MARPE could leave you ending up like this. Just similar. So let's present this. See, like, good jaw, good everything. Is just like his eyes are not on the same level. And it bothered this guy. And I understand why. Because, like you're not... People understand the importance of eyes. That's why you need to just skip MARPE. Because, like I said, if it goes wrong, it goes wrong really bad. And it's not easy to fix. Let me tell you what you have to do to fix it. If MARPE does... If the thing that changed your eyes is skeletal and it caused vertical dystopia, let me show you what you have to do. And this is scary. You have to do this. The 7 layers of vertical orbital dystopia. Right? So they basically place an implant on the lower eyeball. But then you have to do like a canthoplasty, blepharoplasty, just to match the eye. When it was fine to begin with. But I'm going to show you an example. So they cut your shit open here. Like, that looks scary. That looks invasive as hell. They got to place all that. They got to place all that. So imagine you do MARPE. Then you go through something like me or the other guy. Right? And now, your jaw's corrected. Your breathing's corrected. But now you have a new problem with your eyes. Because MARPE dropped down one of your eyes and it made asymmetry in your eyes, which, some people still look fine as hell with an eye asymmetry. But you really have to lock in and make everything else about you so good, like your hair, your hygiene, your skin tone, your skin quality, your attire. Now you got to overcompensate to bring the whole package up. When you could have just been you. And like I said, guys, this is not really body dysmorphia because it's a real problem that you did to yourself. This is like surgery regret, more whatever you want to call it. Doctor, let me show you an example of like Epley's other cases. Because it doesn't show the actual patient that he did like 12 years ago. Right? Let's see. Let's go to the vertical dystopia. Let's see. So this is explored plastic surgery. That's Epley's. Okay. So look at this. Let's see. All right, I think it's this one. He always is making updates or modifications, right? Look, this is the guy. This guy went through it. So look, case study. This male had left vertical dystopia of 5 millimeters. 5 millimeters. No visual acuity, no or double vision problems. Okay, that's pretty good. So then they placed an implant here. Opened up his eye. Boom, boom. And now his eyes are leveled. Aesthetic vertical orbital dystopia of 5 millimeters or less of horizontal pupillary lines, discrepancies, okay. The anterior orbital floor and eyeball can be safely raised up to 4 or 5 millimeters using a custom. So this is good. Mine is not so severe where I have to do like orbital box reconstruction. Like that's when you're really cooked. But most people are born like that. So it's like, whatever, you lived your whole life. No big deal. You have years to it. But like when you are not like this and then you do it to yourself from a procedure that wasn't supposed to affect your eyes at all, well, now you got to do this shit. So now let me just recap. Imagine I talk to so many people on Reddit that say, dude, do I need a MARPE? Or like, bro, I need a MARPE. Like my hollowness under my eyes. They're like 21, 19, 17. These kids don't know anything about life or the consequences of these surgeries. Most of them look good because they're young, bro. Go live your life. Like that's what I would have told myself 2 years ago even. Go live your life. And if it really bothers you hardcore, then just do the most invasive surgery so you can get it done with. This is what I've realized in business and real life. If you try to avoid the big problem, you're eventually going to have to deal with it. If you try to do the minimal invasive procedures like myofunctional therapy, working out your tongue, that's myofunctional therapy, palate expander, orthodontics, TADs, like you're kind of like dodging the real problem. And then when you become so unsatisfied and you go through all this effort trying to fix it the least invasive way, which was more invasive in the first place, you're like, I should have just done the biggest thing from the start. So yeah, guys, nobody talks about this. And honestly, if people lose business from doing a MARPE, honestly, I save lives. Because the orthodontics can't fix your fucking eyes if the maxilla drops down. And it happens way more often than people talk about. It's just that you don't hear it online. And like I said, it's like playing Russian roulette. 6 bullets in the chamber. 5 out of those times, you're going to be fine. You're going to get a good expansion. But what happens if you're that 1 out of 6 where shit goes wrong? This is what you're going to have to do. You're going to be like, fuck, I have a cant. Overexpanded. Asymmetries. I breathe better. But then you're not used to your face. Because like I don't mind my face changing. I know when it changes for good and bad. And there's some things that change about me that were really good. And some that are not good. Objectively speaking. Compared to my past. And then you're like, how do I fix this? Well, if it's a skeletal issue, now you gotta think about money that you gotta spend. Now you gotta do cosmetic procedures. I never grew up thinking I would do cosmetic procedures or surgeries. I was thinking like, I'm gonna just live my life, whatever. But then if some of us don't develop well from eating slave ass food, grain maxing, slave trash maxing, well then we start doing things and improving our lives because we believe in being a better version of ourselves. We believe we can be better. And because I earned a lot of money from my business, I was like, you know what? I could do something for me. I could change my life for the better. And honestly, it has for my breathing. It has. That's the one thing that MARPE did for me. It improved my nasal breathing. I'm good. I perform better in life overall because of it. I don't stress about breathing through my nose. It's just the airway constriction when I sleep. Just the sleep quality has to improve. It did improve with just MARPE, but it's not cured. That's why I'm doing the double jaw surgery. But knowing that double jaw surgery can improve the aesthetics part of it, I'm not going to lie and say, oh, I'm just doing it for functional reasons. No, surgeries are meant to make you look better. This falls under plastic surgery to fix deformities, and these deformities affect your health or performance, right? So I'm thinking like, you know what, I can do this, and ideally, nothing's going to go wrong or if it does go wrong, it can be fixable. It's when you do something, you don't realize this is a possible outcome, unlikely, but it's possible. And then when it does happen, you're like, fuck, what do I do? I'm kind of blessed that, if this were to happen to anybody else, I feel bad for them. But because it happened to me and I know my capabilities, I'm a problem solver, I know I can fix all this. It's just a matter of learning about it, evaluating the risk to reward ratio, and either executing on this or not. That's really it. I think for other people that were not in my position, maybe they just don't have the money or the insurance to do this stuff. I do right now. I'm blessed. But like I said, man, this is the asymmetry that you can get from a MARPE expansion if it goes wrong. And I'm not saying, and this happens with many providers, so it's not even just the provider that's the problem. It's the device itself. It's not advanced like a double jaw surgery. If you're really maximizing, if you really want to be a maxer, I think you should just do the double jaw surgery and move on with your life. I think it's way better return on investment. To be honest, it is. Frank Tufano did a good double jaw surgery. The girl who got messed up here did a double jaw surgery and she's moved on with her life. Thank God. Bless her. But let's say you get more than just a skeletal cant and you get more of this. It's like now it's on your mind and it's something that you have to either accept or address while it's important to you. The thing that you should not let it do is consume you, right? For this past year, the first month when I was expanding, I was like, oh, I'm getting kind of worried, man. I look off. I just didn't know what it was, and then I understood what it was, but by then it was kind of too late because I've already formed the bone, so I'm like, well, shit. I'm just going to, move on with my life. People only bring up the asymmetry here, but they don't bring up the asymmetries anywhere, which is okay, fine. People might not even notice it, to be honest. It might not even be important, but to me it is because I was better before. That's the thing. If I was worse off before, if I started off like this, if I was born like that, it's whatever, no big deal. But because I wasn't, and it got worse, I did something to myself that ruined something good about me. It's like the OCD. It's like you want to be a perfectionist or just being a responsible human being. You want to fix what went wrong, right? So yeah, guys, don't do MARPE. Just skip the double jaw surgery. And honestly, having a wider face is not bad as long as it's symmetrical and you do a double jaw surgery. I think if you do a MARPE, you have to do double jaw surgery just to balance everything out. You just have to, right? I wasn't of the belief of this a couple years back when I started, but ultimately, many people are going to have to do double jaw surgery if they do a MARPE. That's what you got to understand. If it goes wrong, you're going to do a double jaw surgery. I'm just telling you that now. Like I said, I didn't know double jaw surgery when I started this. When I saw Jaw Hacks' interview with Dr. Alfie the first time, or the second one, I think, in 2024, that's when I barely learned about double jaw surgery. I'm like, oh, that's kind of cool. All right, I'm going to just do my MARPE, whatever. Because I got it at the same time that interview came out. And a year later, I learned everything about double jaw surgery and what it can do for me to fix it. Right, and at this point, there's no turning back. I have to do this because either I live with the cant, yes, I breathe better, but I live with a different aesthetic result that is not good for me, or I do something about it while I still can. So I'm going to do the double jaw surgery and then the asymmetries from the eyes and all that. After the double jaw surgery, what gives me hope is that the guy who did the surgery, and with this woman too, even their eyes look better after the double jaw surgery. So in my case, it might help me. And the guy who did the double jaw surgery, like I said, his eyes look way better, more balanced. The problem got fixed after the double jaw surgery, which is kind of amazing, to be honest. But I'm not expecting the jaw surgery to fix the asymmetries formed above the nose. I'm being realistic, and then depending on how satisfied I'm with the double jaw surgery, then I will eventually go down the road and consider maybe doing more cosmetic surgeries to fix everything I did to myself. And that's really it, guys. So just skip MARPE. Just skip it, man. Only because when it goes wrong, It's gonna go wrong bad. It's not easy to fix. Like I said, it's like a felony. Once you get caught by drinking and driving, it's not a slap on the wrist. You got a felony. You're in the system. You can't get hired. You can't get insurance to cover you. You're unemployable. People just hear felony and they think you're a murderer. Like, it's like that. It's like that. Once MARPE goes wrong, go undo the terms and fix it. Good. Shout out to Jaw Lady or whatever her name. I don't know what her real name is, but she's done FME, MSc, and now she wants to do a MARPE. I told her, just do a MARPE. Like, God is watching over you, or you just have good intuition. But I say God because like, you really could have messed yourself up with the MARPE, and then you would have still done double jaw surgery. I told her, just do double jaw surgery if you feel like your nose is constricted. They can shave down the bone. Just do it. You have a good face. It's balanced. Just more projection, and you're good. Move on with your life. You can get it done in 2 months because you already have a good bite. These people that don't go through this are getting too greedy and think only they're going to get positives. They're trying to chase the cheekbones and the width that I got, or that most people get. But they don't consider the harmony of it. You could get wider, but it can get asymmetric. And that is hard to fix. Alright, guys. That's it. Very passionate video. Oh, yeah. And I just want to say, MARPE costs you like $7K, $10K, $15K. It goes bad. Now you got to spend on a double jaw surgery that could be $100,000, $105,000, $200,000 without insurance. But let's say you get insurance and a genioplasty. Okay, now that goes from $10,000, $7,000 to $15,000. You add a double jaw surgery. That's another $15,000 to $20,000. So now you're getting close to $30,000. And let's say you get asymmetries all over your face because of the MARPE. Now you're going to do cosmetics for your eyes, your eyelids, blepharoplasty, canthoplasty, orbital implants. $10,000, $20,000 more. So you just went from trying to do the least invasive procedure of $2,000, $5,000, $10,000. You get one complication that is so hard to fix, and now you're in the fucking rabbit hole of cosmetic surgeries. I'm ending MARPE. I thank God for MARPE for fixing my nose, but like, if 10 people in this video get MARPE, 2 of them are going to get this result. And the result that you saw on the PowerPoint. It's going to happen. And not many of you have the money to fix what will happen if it goes wrong. So just do double jaw surgery. It's covered by insurance. More precise. There's professionals, high-level doctors that can get you the breathing through the nose and through the throat. So just do double jaw surgery, guys. Just do it.